Welcome to the College Connection podcast, a podcast presented by the College of Registered Nurses of Newfoundland and Labrador. This is the College Connection podcast.
Hello, and welcome to the College Connection podcast. The College Connection podcast is made available to registered nurses and nurse practitioners and promotes good practice, and it highlights the importance of regulation in healthcare. My name is Kelly Kean, and I'm a registered nurse and a nursing consultant with policy and practice at the College of Registered Nurses of Newfoundland and Labrador.
And my name is Michelle Carpenter. I'm also a registered nurse and a nursing consultant at the college.
Today's episode is called Ask Practice, and Michelle and I will be providing answers to some common questions that we receive from registrants. Michelle, the first question that we have received from a registered nurse from notes from the practice team is about floating. So registered nurses commonly ask if they are required to float as a part of their practice.
Thanks, Kelly, for that first question. So the answer is yes. If it's an employer requirement, then the registered nurse is expected to float when, another unit requires staff. The key is for a registered nurse is that when they float, they work within their individual scope, their individual competence. So with whatever unit they're working on, they have built competencies, like the necessary knowledge, skills, and judgment that they have built working in that unit. So when they are floated to another unit, they bring those competencies with them. But the key is that the registered nurse is still accountable for the care that they provide. So when they go to that new unit, they may be assigned to a client, or they may be assigned to help out with a client. And the key is that the registered nurse works within their individual scope. So they're not going to do anything that's not within their individual competence. So if they don't have the necessary knowledge, skills, and judgment and is unable to safely perform that competency and safely manage the outcomes of care, then their responsibility is to, notify the charge nurse or the nurse that's assigned to the client if they're not assigned to that client independently, and let that registered nurse know that this is not within their competence. So they're not expected to do anything that they're not educated, authorized, and competent to perform. So while I know it's very stressful to be floated to another unit that is unfamiliar, there's some safeguards that they can do. They can ask for an orientation. It could be a very quick orientation to know where, the emergency exits are. Where is the medication cupboard kept? Some of those things that they would need to know, the general layout of the unit. But the key is understanding that they're not going to be expected to do anything for that client that's not within their scope of practice, but it's their accountability to speak up and notify the registered nurse who's in charge or the nurse who's assigned to that client to notify them that this isn't. They can help with those basic competencies that they have with the client care.
Absolutely. So it sounds like, being aware, of your own individual competence, but making sure that there's that clear expectations for you. So having that discussion with either the manager or the clinical educator of the unit where you are floating, so that they have those reasonable expectations of the person who's being floated. Yeah,
absolutely.
That makes sense.
Right. And it's just like in the times when we have shortages, we have to prioritize, right?
Mm-hmm.
What are the client care needs? When you go to that unit, you have to identify what is within your scope and to determine what are the client care needs for that particular client that you're helping out with or assigned to.
Yeah.
Perfect.
Thanks, Michelle.
Okay. So, Kelly, as I'm sure the listening audience knows, as a registered nurse or nurse practitioner, there's a requirement to complete their continuing competency program and to participate in the CCP audit. But with the Alinity member portal, no one else has to submit requirements anymore. They're there in their My Learning. So this past summer, from July to early September, the college conducted the CCP audit. So can you tell us about the results of from this new audit in the Alinity member portal?
Sure. Yeah, you're right, Michelle. So the audit was started in July of 2024. And like you said, I mean, registrants now with the Alinity, you have to complete 24 hours of learning. You have to have that logged before you can move through that licensure renewal. So, everyone had those 24 hours logged. And we audited just 324 registrants is what we audited, which came out to about 5% of registered nurses and 10% of nurse practitioners. And just over 100 registrants needed to resubmit their learning plan. So this was the first year using Alinity for the audit, and we haven't done a formal evaluation, but anecdotally, registrants found that audit process was quite simple. So making the edits and then the resubmitting and then finally having that approved, very efficient, and it's not something that was lingering for any longer than it needed to. So it was, it was quite the efficient process and quite simple to follow. But like I said, there were 100, just over 100, sorry, that needed to be resubmitted. And one of the most common reasons that registrants needed to resubmit was because of the learning impact statement. So, the first query in the learning plan, you put in the date and the time and the number of hours, and then you say what the learning activity was. So maybe you attended a webinar, so you would say webinar in the title. But then the next one would be, it talks about that learning impact, where you need to include what the new knowledge gained was and what was that immediate impact on your practice, in your practice setting or your professional practice. So for example, registrants would include, most registrants would include, tell us everything that they learned during, let's just say it was an education day that they had. But it was the learning impact statement. So it was the impact on their immediate practice that wasn't clear or wasn't included at all. So we have to remember, there needs to be, it could be quite simple, but it's a sentence to say, this had an impact on my practice by, having up-to-date knowledge or best practices related to whatever it is that you learned so that you be able to provide safe care. Sorry. So that was definitely one of the most common reasons for resubmission.
And so what were some of the other reasons, Kelly? And what can registered nurses and nurse practitioners do to prevent, having to resubmit, next year?
Absolutely. The other one that was common was the use of preceptorship. So, I mean, of course, a lot of registered nurses and nurse practitioners are preceptoring students and new hires. And during that time, when you are the preceptor, when you're sharing your expertise, your knowledge to that student or the new hire, then that's not you learning new knowledge. You're sharing what you already know. But we recognize that there's often a lot of prep work that goes into being an effective preceptor. So you may be making sure that you're up to date on best practices in your practice setting. You're up to date on the policies. You're maybe looking up new medications. Some individuals may choose to do some courses related to preceptoring. All of that stuff counts, but the time spent preceptoring is not what you include. So, we had several where, they had a student for 8 weeks, and, it would be they would just put in that 8-week time period, and include those hours. But it has to be clear that it's the prep work that you're including in that learning activity. This is similar if you're doing a presentation at a conference. Most presentations at a conference may be an hour or 2 hours. You wouldn't include that time where you're sharing that knowledge during a presentation, but you would include all of that prep work. So if you're doing a literature review, that would take a lot more than the time that it takes to deliver that presentation. So those are the things that you need to include in your learning activity, not being a preceptor and not doing the actual presentation. And sorry, Michelle, what was the second part of your question?
Oh, and well, before I get there, is there like what can they do to prevent having to resubmit? So there was, I think you also we had discovered about submitting all your learning into one learning activity. So can you comment on that and any tips for for next year to prevent this?
Absolutely. Yep. So it wasn't common, but there were times when it would be one entry. So the learning activity was for 24 hours, and it was an entire list of everything that was completed during that licensure year.
Yeah.
That wouldn't be appropriate. You should break up all of the learning activities. Now, that being said, if you were to attend, let's say, a 3-day conference somewhere, it is appropriate to include that as one learning activity. Some people may choose to break it up, and that's okay because different things are learned on different days. But if the registrant chooses to lump that same conference together, well, that makes sense. In the same way, if you're prepping to be a preceptor, you can include that prep work. You can reflect on how long did it take you, and you can include that as one learning activity. Or if you're things like looking up different medications, we wouldn't expect 5 minutes for this med, 5 minutes for that med. You can group those together when it makes sense, just not to put your 24 hours of learning into one learning activity. That wouldn't be appropriate. And the best way for, registrants not to have to resubmit is to be aware of what is expected. So we have a CCP framework and a CCP guide on our website. It's, if you go into practice, you'll see a CCP, continuing competency program. A tab, and you can find all the information that you need to know related to the continuing competency program there. Have a read through that, and of course, that counts as a learning activity in itself. And we also have podcasts and archived education events available as well, related to Alinity and CCP. So I encourage registrants, if they haven't already had a listen to those education sessions, I highly encourage everyone to do that. And again, of course, it counts towards your CCP. So yes, being familiar about what those expectations are is the best way to avoid needing to resubmit.
Absolutely. And if the listening audience hasn't listened to the special event that we did in September, then that is available. And as well, they can call us, right? We can provide information as in a practice call to answer those questions about CCP. We're only too glad to help registrants meet their CCP requirements. So
absolutely. So Michelle, I have another question here.
Sure.
From a registered nurse. What should a nurse do if they suspect drug diversion or substance abuse in the workplace?
Well, this all goes back to your accountability as a registered nurse. And, in our standard 1, responsibility and accountability, there's 2 indicators. 1.2, practices in accordance with the relevant legislation, standards, regulatory requirements, and employer policies. But also is 1.5, accepts responsibility and takes action to ensure fitness to practice. So I draw your attention to those 2 indicators because there's a piece of legislation that is the RN Act and the RN regulations where it says there is a duty to report of registered nurses and nurse practitioners when there is direct observation or objective evidence of conduct deserving a sanction. And within our bylaws, that those definitions of conduct deserving a sanction are specified. And so if you're unsure what that means, then you can look up on our bylaws in About, under the tab About, but it defines what would be fitness to practice issues. There's also a definition, which is another standard, is our Code of Ethics that defines fitness to practice. So there is a responsibility of the registered nurse. If that registered nurse sees another, nurse, whether it is an RN, LPN, nurse practitioner, diverting medication, if there's direct observation or objective data evidence, they have to call the Director of Professional Conduct Review, and if it's a licensed practical nurse, they call the registrar CEO. But there's that requirement to call and state the facts to the Director of Professional Conduct Review for RNs and NPs, and the director will determine if an allegation will be laid against that individual. So if that individual is unsure whether it is conduct deserving of sanction, they can certainly reach out to URI to help them discern if the standards have been broken, or is it conduct deserving a sanction, I should say. And we will certainly refer the individual on to the director. So it all goes back to fitness to practice and accountability of the registered nurse. And when we talk about duty to report, and we've done other podcasts by the Director of Professional Conduct Review, if registrants want to go back and listen to more detail on about duty to report, but it's understanding that they must call the college. That doesn't mean that they have to lay an allegation. That usually an allegation within the healthcare system, usually it's from the manager and the professional practice that lays that allegation. But they must call, the college. But they also have to inform their employer, their manager, that they have observed this action. What has occurred. We've seen our colleague divert medication. So that will be then dealt with by the employer, but you have to fulfill your duty to report. So if it's suspected, I would certainly have that conversation with your manager. So if there's not that direct observation, or you are not able to share, understand or discern into the documentation that something may be off here, but I'm not really sure. But that's when you would call your manager. You might bring in professional practice. You might bring in quality and risk, with having that conversation with your manager to determine if something is going on. And that's if you're unsure of what to do, they can certainly reach out to one of us to help them. But that's what an RN is responsible to do, meeting your indicators that if there's something there, then you need to take action. Because in that investigation, if it's shown that a registered nurse had knowledge and didn't report it, then they could be having an allegation laid against them. And it's really important that you may, even through conflict resolution or having that conversation with your colleague and say, look, I'm not sure what's going on here, but if you're experiencing any fitness to practice issues, maybe you need to speak to the manager. You need to, seek resources. You might need, access to the employee family assistance program, or you may need some addiction services. That's a conversation that may be difficult. That'll be up to the RN or NP themselves, but reach out to your manager, because at the end of the day, it's all about client safety. And if a nurse is diverting meds, then that client is not getting their meds, right? So it goes back to understanding your responsibility and accountability.
Absolutely. And yeah, you linked it back to the standards of practice for RNs and NPs, and it's right in Standard 1, responsibility and accountability. And those standards are linked from the legislation, which is law, of course, with respect to duty to report. But then, and also there's other laws with the Controlled Drugs and Substances Act as well, that we have as registrants, RNs and NPs, we need to make sure we're adhering to. So if there's any discrepancies, like for narcotic counts, there's certain processes that you have to follow by law as well. Absolutely. So yeah, that's right.
Yeah. Yes, because there's that narcotic control, like under the narcotic control regulations. If there's narcotics that are lost or stolen, that has to be reported right to Health Canada. Now, generally, it probably might not be the nurse, but the nurse may help with the collaboration with the manager to fill out that form if there's narcotics that are missing. So, yeah.
Absolutely. Yeah. Michelle, another question about documentation. So we had a registrant reach out about their struggle to maintain timely documentation and what could happen if they left their shift without completing their documentation.
Okay. That's a really interesting question, and it really ties into the CNPS webinar that we attended in the last couple of days. And, what's timely depends on the context of, if you're in community, timely may be, right at the bedside. It could be that when you get back in the car, like the nurse has to use their clinical judgment. But CNPS says it's contemporaneously, as as close to the care as possible. So if you're in acute care and someone is, acutely ill, if you don't have that point of care documentation, like a computer on wheels or workstation on wheels, that you're able to do it, it has to be as timely as possible. As well, in our standards, under Standard 2, knowledge-based practice, we have an indicator that says that RNs and NPs must maintain accurate and timely documentation, including written and electronic documentation. So the responsibility of the registered nurse and nurse practitioner is that they have to document the care. So documentation is not optional. It is a part of nursing care. So a part of that nursing process, when we're assessing the client and we're developing a plan, and then we identify interventions that we're going to do, and we implement them, we have to evaluate them. But part of that nursing process is documenting what is the client's response to those medications or those interventions. So a part of nursing care is we do the nursing process, but we document that. And the documentation serves as the story, the client's story. And documentation is really important as evidence to show that this is the nursing care that we provide. So as a reasonable, prudent nurse, it's expected that you document the care that you provide as close as possible to the care as reasonably possible. There's going to be circumstances where it's a challenge. We understand that, but you have to use your clinical judgment. And in our documentation principles, we have a document on our website that RNs and NPs can refer to, and it was done collaboratively with the College of Licensed Practical Nurses. But RNs and NPs can refer to that document. So it's important to realize that the care that is provided by that healthcare professional has to be documented. If that documentation doesn't occur, then again, that could be viewed as conduct deserving of sanction, and we go down that, reporting to your manager. But it's also a safety issue, because the purpose of documentation is to provide the care, or documentation of the care that's provided is the client's story. But it's important that the healthcare professionals that are within the circle of care that are coming in after you is able to seamlessly take over that transition of care. They're able to pick up the client's chart and know exactly what has happened to the client. So if you don't document, then there's no way to know that what has been done for the client. So that could lead to errors. There could be additional medications. It could be double the medications as provided because it wasn't documented. Mm-hmm. Or the healthcare professionals would not be aware of what interventions that you've done with that client.
Absolutely. And, the focus, of course, being safety on the client. Yes. And, we recognize that registered nurses and nurse practitioners, they're delivering that safe, competent, compassionate, ethical care on a daily basis. But you never know when your care could be brought into question. And I guess looking at it from that's your first defense, is that quality documentation in the chart is your first defense, because you don't know how many years may go by. You can't remember what you've done and what you didn't do for a particular client. So, having that quality documentation will definitely assist, if anything were to be questioned related to the care that you provided.
Absolutely. The quality documentation will serve you well. And we always say that if you adhere to your standards and do quality documentation, the likelihood of going down that allegation road is very slim. And I also want to refer the listening audience to what CMPS says, that if you don't document, there is inference in the law, in case law, that nothing documented, nothing done. But, the lawyers will look at the circumstances. But, if you decide to leave the unit, at the end of the shift and not document, then, it could lead to client safety issues, but also could be an allegation laid against you. So, and again, any questions, reach out to us.
Absolutely. Absolutely.
So, Kelly, We've one of the questions that we got from notes from the practice team when we put that call out was about cosmetic procedures, and you and I are getting a lot of questions from RNs and NPs, particularly since COVID. There have been a lot of people that have moved into self-employment, and particularly cosmetic procedures. So, can you tell the listening audience what RNs and NPs need to know when they're considering going into cosmetic procedures?
Absolutely. So yes, we were getting so many questions related to cosmetic procedures that we did create a resource for registrants to refer to, and that was approved by Council earlier this year. So it is available on our websites under practice topics. You can find that. And the way that document is structured is that we look at the scope of practice framework, meaning where the scope of practice framework looks at three elements if you're able to do something, and that's education, authorization, and competence. So let's just talk a little bit about education first. So as a part of entry-level competencies, registered nurses and nurse practitioners, they don't learn about cosmetic procedures in their entry to practice in their programs. So they must get continuous education. And when you receive this continuous education, it needs to be both theory and you need to have an opportunity for practice as well. Okay, so it has to be that theory and practice. So that's the first thing related to that education. So once you have the education, then you have to think about your authorization. So registered nurses, we have some RN prescribers, but registered nurses are not authorized prescribers. Therefore, they are going to need that authorization from an authorized prescriber, whether that's a physician or a nurse practitioner, to give them that authorization to do whatever cosmetic procedure it is, that the client requires. So that could be in the form of a direct order, or it could be in a care or a medical directive that lays out, those parameters, what that client needs. But also there should be care directives available for the RN to manage any outcomes of care as well. So, if there's an anaphylactic reaction, what to do in those situations. So we have to think about that. So RNs require that authorization in order to be able to provide that care to the clients. Now, nurse practitioners, of course, are authorized prescribers. So with that education, they can prescribe and they can, carry out that cosmetic procedure for the client. But one of the things about nurse practitioners, if they are providing authorizations to the registered nurse, they have to determine the appropriate level of supervision. And this is laid out in that document as well. So, you have to look at the client characteristics, what the procedure is, the environment where it's occurring to determine the level of supervision that is needed. Okay. So that's there in the document, and I encourage everyone who has questions to read up on that.
Kelly, the MP, would they need education in cosmetic procedures as well if they're going to be that medical director?
Yes, absolutely. So that's a question that we receive from registered nurses as well, and nurse practitioners. Someone reached out to me and they asked me to be that, the medical director for my, for the practice, but a nurse practitioner would need to have competence in cosmetic procedures because, how would they be able to manage those outcomes of care, if not competent in it themselves, right? You wouldn't authorize someone to do something that you don't have that competence in yourself. So yes, that's a good point, Michelle, because we do get that question quite a bit. And then finally, you look at competence. Okay, so competence meaning, do you have the knowledge, skill, and judgment, and can you safely manage the outcomes of care? So registered nurses and nurse practitioners need to know if that procedure is within their individual competence. So was that a part of what I learned? Because we know cosmetic procedures is changing every day and new things, wonderful things are being added all the time. So we have to make sure that they have that knowledge skill. You have to make sure that you have the knowledge, skill, and judgment to do that particular procedure. And also you have to make sure that you're implementing strategies that reduce risk, because of course, cosmetic procedures is not without risk. So we want to make sure that you have the necessary knowledge, skill, and judgment to identify those risks and then implement strategies to mitigate the risks as well. So that's really going through the main points of the scope of practice framework within that document. But then there's other considerations as well, like the Personal Health Information Act, so FHIA legislation. If you own that cosmetic procedure business, well, then you are the custodian of the client's healthcare information. So you have to make sure that you're adhering to that FHIA legislation. And if you're a registered nurse, and let's say you don't own the business, let's say you're working out of a spa somewhere, then you may be that custodian of care as well, because that spa is not offering health services, but you are there offering health services. So you may actually be the custodian of care, and the custodian of the client's care chart. But we encourage registrants who are in self-employment, and if they're asking questions about FHIA, there is a toolkit for small custodians that is available online through the Office of Information and Privacy. So if you just Google that, you can review that toolkit. It's a very well laid out toolkit, and we have it referenced as well within the cosmetic procedures document. The link is there for that.
And Kelly, is that at the government, Newfoundland government's website, right?
That's right. Yeah, exactly. Yeah. And as well, infection prevention and control measures. Of course, you need to make sure always, no matter what practice setting you're in, you're following best practices with respect to infection prevention and control. And a good resource is Infection Prevention and Control Canada, if you want to learn more about that. And another key piece is informed consent. So, of course, cosmetic procedures being elective, there's more expectations around consent and making sure that the client understands the risks and that it be informed of all possible risks related to that cosmetic procedures. So information related to that is in our document as well. But other considerations that we tell registrants is reach out to Canadian Nurses Protective Society. So that's our liability, the company that provides our liability protection. And when you are engaged in cosmetic procedures, that liability risk may be increased. And of course, they would be the best ones to tell you, maybe you should have more protection. But as well, if you have your own business, then you have that business insurance piece as well that needs to come along with it. Other considerations in self-employment related to occupational health and safety, and making sure that you're adhering to legislation around occupational health and safety, having policies, because even though you may be the employer and the only employee, you still need to have those policies related to occupational health and safety, as well. And other policies that support your practice as well, like, going back to cosmetic procedures, making sure that policies are in place. What do I do in the event of an adverse reaction? Is that laid out there in policy of what you are supposed to follow? Because if anything were to happen and the care was questioned, one of the first things that's going to be asked, well, what did your policy say related to that? So, having those policies created is very important as well. And the final thing I want to mention about self-employment is the self-employment checklist. So when a registrant is engaged in self-employment, they are expected to complete the checklist that's on the back of our self-employment document on our website, and submit that to the college. You answer yes or no to every question. If you answer yes to everything, that will get forwarded on to registration so that your practice hours can be counted towards your RN or NP practice hours. If you answer no to anything, you're most likely going to get a call from Michelle or I, and we just have a discussion about that. Perhaps you didn't understand the question, or, we just need to have a conversation just to ensure that the work that is being done is considered nursing practice, of course. So I encourage anybody who may be out there who hasn't completed that list and is that checklist and is doing or is engaged in self-employment to complete that checklist and make sure your Alinity profile is updated with with the employer information.
Okay, great answer. So Kelly, we talk about again, registrants can reach out to us if they have questions. And there's a lot of considerations. And we always say, it seems like a lot, but, again, we go back to public protection. We want to ensure that registered nurses and nurse practitioners know those expectations, those practice expectations, and what are the legislative requirements. But there's also, we get a lot of questions about policies, and you talked about, IPAC, are you using single use or autoclave for your instruments? If you're using laser, what are those quality controls? That all needs to be laid out in policy. And as the regulator, we don't give that clinical information, but I understand there's a special interest group that NPs and RNs could reach out to assist them.
Absolutely. Yes, it is called, it's CASE, so CASE. RN, so it's Canadian Association of Self-Employed Regulated Nurses. So that's a really good resource for any nurse, regulated nurse who is engaged in self-employment. They can certainly help out with making sure you have everything done according to best practices and what you should be following. Absolutely.
Yeah. So I understand you talked about self-employment, but there are RNs and NPs that are employed. And so it's really important that, the employers know what the expectations are. So I encourage, registrants to share our documents on, cosmetic procedures, self-employment, advertising. The employer has to know what is appropriate when they advertise a registered nurse or a nurse practitioner providing these services. So really important that is that collaborative effort if you're employed and the employer requires those policies. And one thing I wanted to ask you about was the informed consent. Did you mention informed consent?
Yes. I talked about informed consent, and the considerations for informed consent is because cosmetic procedures is elective. That other procedures that get done, in acute care when you need surgery and those things, when information is shared about risk, of course, clients need informed consent in acute care as well, but when they look at the risk of what may happen, it's like the most likely because cosmetic procedures is elective. All risks need to be disclosed to the client. So it's very important that they have all of that information. And also, Michelle, informed consent too around, you see, I'm sure people are familiar with seeing social media posts related to, before and after.
Testimonials,
absolutely. Making sure that that consent is documented from the client before that is, shared, right? And it's also, that subjectivity of the result. Like, someone may say something negative on social media about that. Like, oh, why would you do that? You were something along those lines.
Absolutely.
You never know, right? You might think you look great, but someone else might, may differ in that opinion. Yeah. So it's about that subjectivity as well. It just carries a little bit more risk. A little bit more liability risk there for the practitioner.
Great discussion on cosmetic procedures. And, with this new document that we had approved by council, it really provides that in-depth information, on the practice expectations. And, again, and we talk about, if you're going to use the products, they had to be approved by Health Canada. Lots of great information in that document. We have a lot of great information, and if you're in self-employment, you need those also relevant documents, self-employment and advertising nursing services to assist you. But again, reach out to us. So I'd like to say thank you very much. And that concludes the first episode of College Connection Ask a Consultant, Ask Practice. And stay tuned for episode 2, coming soon. Thanks.
Bye, everybody.
Take care. Bye-bye.
This has been a presentation of the College of Registered Nurses of Newfoundland and Labrador.